light exposure is another interesting feature and possible treatment for depression. So, as I already mentioned before, the role of circadian rhythms is really important in our in coordinating our sleep and wake cycle, our feeding behavior, and our cyclical release of different hormones. And so, it was found with seasonal affective disorder, which is, like the winter blues, as people call it, when people start to get some of the symptoms of depression during these times of the year with low light exposure, that it was found that in these people that they improved with the treatment to bright light. Typically, this is around 10,000 lux or higher, which is roughly about the amount of light exposure during dawn or dusk. And this was found in another study looking just at cortisol levels. If you remember, I've spoken about cortisol before, which is released by the adrenal glands, which sit on top of the kidneys. Cortisol likely has a strong role in many people's major depressive disorder. And anyways, in this study, there were 20 healthy men and women who were placed in an environment for 10 days where there were no outside cues of the time of day. So there was no, rising of the light and then setting and dark time. It was just the same throughout. And it was found that the people who had exposure to about 7 hours of bright light, which is 10,000 lux, that these people had reductions in their cortisol levels, and this could mean that they could have likely some reductions in their depression, and as in comparison to that, those who had sort of like candlelight light exposure did not have the same reductions in their cortisol levels. It is important, though, to remember that our bright light exposure, and particularly blue light exposure, which is just one piece of the wavelength or of the frequency of the color of light, that exposure to this needs to happen during the right times. It needs to be during daylight hours. But when we have exposure to this at night, which is so common now with so many screens that we live with, that this can directly inhibit our body's release of melatonin from the pineal gland. The pineal gland releases melatonin, which makes us feel sleepy, and it's a very common treatment actually for insomnia, that people take melatonin. That is just like our body's natural substance that's produced. So bright light, if exposed to too late, can result in inhibition of our body's release of melatonin. In addition, it's been found that melanopsin, which acts on our what's called suprachiasmatic nucleus in the brain, which sort of helps to control sort of how alert we feel. The melanopsin actually activates the more sort of alert daytime energetic sensation in our suprachiasmatic nucleus. So for these reasons, it's important to not be exposed to bright light and to blue frequency light in the evening hours before we go to bed, because indeed for depression, poor sleep is a major factor. About 80% of patients with major depressive disorder report poor sleep quality, and poor sleep quality has been found to be a major risk factor for suicide. So it is very important to get good quality sleep while we are dealing with major depressive disorder. So while we have been thinking about light exposure and depression, it has been mostly in the context of seasonal affective disorder, like I just talked about, until there was a randomized controlled trial that was done. There was 122 adults that were that all had depression, and they were given a light exposure therapy. And this is, like I said, a randomized controlled trial. So there was a group that was given light exposure therapy. There was a group that was given light exposure therapy plus antidepressants. And then there was a group that was given a placebo. And it was found in this that there was a significant reduction in depression in both the patients who got the light exposure therapy and the antidepressant together, and also to those who just only had light exposure therapy. The best reduction was in the combination of an antidepressant with the light exposure therapy, but nonetheless, it showed that even in patients who likely don't have seasonal affective disorder, for those who have major depressive disorder, light exposure therapy may be a good monotherapy or something to try on its own as a treatment for depression. So that's a very interesting factor that sort of ties everything together here of the importance of light exposure in depression, in seasonal affective disorder, and the considerations to have with this in the context of insomnia during depression.